Welcome to MetroHealth Studio. We're changing things up because, as MetroHealth says, change is healthy. In each show, we'll be on location here to talk with an expert about medical issues that concern you. For instance, you're run down and feel tired all the time. Have you overdone it, or is it something else? Dr. Noha Dardir is here to help identify the onset of anemia and what that means for older adults. Dr. Dardir is in the Family Medicine Department with MetroHealth. Welcome to the show.
Hi, thanks for having me.
So shouldn't we be more tired as we age? Isn't that pretty normal?
Some of it is normal, so some senior might have to cut down on some of their activity as they get older. Some might just continue to do the same thing with no cutting down. But what we are talking about is out of the ordinary. So if things you are used to do seems a lot more tiring to you than normal, so different than your baseline. So we are talking about anemia.
Okay, so tell us, what is anemia?
Anemia is a low blood cell count, red blood cell count, and the red blood cell normally carries the oxygen in your body through your whole body. So that's what pretty much anemia is.
Okay, so how do you diagnose anemia?
Anemia is normally diagnosed with a simple blood test, so it's a blood cell count, and it's normally part of your annual physical.
Okay, so the doctor should be checking it all the time. So if the doctor finds there is anemia, how is that treated?
There is different kind of anemia. The most common anemia we find is iron deficiency anemia, and it can be treated with oral iron supplement. Sometimes it takes 6 months to rebuild your red blood cell count back, but anemia can be normal in some chronic condition like heart disease, kidney disease, diabetes. If you are a senior with no medical problem and we see anemia, then we have to look for underlying conditions.
Okay, so what if it's anemia and you're looking for something else that could be causing that, and you don't actually have any chronic issues?
Okay.
What do you do then with something like that?
Then we have to look into other testing. One of the most common things we worry about in a senior with anemia with no underlying condition will be blood loss. So we normally worry about colon cancer, one of the big things, so we normally recommend a colonoscopy, which is a preventive measure that we do at age 50, but a lot of patients don't schedule it. So if we see anemia, we definitely have to do this. And then we look at other tests to see any underlying cause of blood loss.
So a colonoscopy going up, how about going down? And endoscopy, is that it?
That too. So we do both. It depends on how level the anemia is, how severe it is, and if we truly sure it's iron deficiency anemia, then colonoscopy and upper endoscopy is recommended.
Okay, and once you figure it out, then you can go about getting rid of the anemia.
Definitely.
All right.
Treat the underlying cause.
Okay, good information. If you're feeling unusually run down, you may want to run over to your doctor and be tested for anemia. As Dr. Dardir noted, anemia can indicate a more serious issue, one that should be addressed probably as soon as possible. To learn more, use the information that's coming up next. My thanks to Dr. Dardir for joining us today in the MetroHealth studio.
To learn more, call MetroHealth at 216-778-7800 or visit their website, www.metrohealth.org.